Okay, let me ask you a couple of things. One, what are dental cavitations and what do we need to know about that? Two, the 3D cone beam, the X-ray you're using, are you concerned about the radiation? The word CAT scan is a scary word when it comes to regular medicine. And number three, if we already have root canals, what the heck do we do? So those three questions,
Right.
cavitation, radiation from the machine, and if we already have root canals. If you guys could comment on those.
Those are three biggies. None of those are small topics. Let's do the easiest one first, which is the radiation. Basically, it is much different than the CT machine, the CAT scan machine that you're going to get at the hospital. It's significantly less radiation than that, and we use all digital radiography now. So it's very short dose. It's very low dose. We have on our machine, we have an ultra low dose setting that we use. So we say it's equal to about 3 hours in the sunshine is the amount of radiation that you're getting from these machines. So it's not the same kind of thing that you're envisioning at the hospital. So when you're thinking about CT machine, a CAT scan, it's not the same thing. We're not talking about the same thing. And it's just dedicated right to this space right here. And honestly, I tell people, I would rather know that you have a massive infection in your head than worry about 3 hours in the sun right now, because we give you vitamin E, a special tocotrienols is what it's called. We have a homeopathic that helps to mitigate radiation in the body. We can do all sorts of things to do that. The information that we gather is worth it. It's worth the radiation. There's
Yeah,
just
I agree. We actually we also use thyroid support drops and things like that. Even though it's little, all radiation is cumulative. But I
Yep.
agree with Dr. Jorgensen completely. It's kind of like when an antibiotic is indicated. An antibiotic is indicated. Yes, you're going to get a little dysbiosis in the gut. Yes, can we deal with that? Yes, but that's a lot easier to fix than subacute bacterial endocarditis in the heart. So I always try and let people know life is full of compromises, and not or refusing to have, dental radiography at least on a periodic basis is it leaves you really in the dark as to, what's under the surface of the coronal portion of the tooth. And, it's like the iceberg, it was what was underneath that sunk the Titanic. The tip of the iceberg is often the smallest part. So seeing an underlying problem like that, I just want to talk about jaw cavitations because I've had a big interest in these for a long time, and I was fascinated, 20 years ago when I first started exploring what the heck a cavitation was, because there aren't any. This isn't being taught in dental school, and most dentists never heard of a cavitation. So cavitation, by the way, is a made-up word. It was coined by an orthopedic surgeon who was doing dissections in the 1930s. I think it was 1931, and he found these holes in the jaw where very commonly where wisdom teeth were removed, that there was this necrotic hole, what we call osteonecrosis. So he came up with the word cavitation to refer to a hole in the jaw, because the cavity was already taken for the term for a hole in a tooth. And so we call it cavitational osteonecrosis, jaw osteonecrosis. The interesting thing now with 3D technology, as Dr. Jorgensen said, when she got her 3D cone beam, it opens up a whole new world of what we couldn't see with a two-dimensional X-ray, primarily because if you have cortical bone where my hand is on the jaw and cortical bone here, they're superimposed, and where my head is the hole of the cavitation. And what we have found is that the old way they went in and treated these, there were guys doing cavitation surgery before I was, and they were going in with a dental drill. And so I adapted a laser, an erbium wavelength of laser, to be able to access this necrotic area of bone. And there's also a wavelength to decorticate the surrounding bone, disinfect what's in there. But before I do anything, I take a pathology sample of what's in there. And what I get is, these are some of the reports that I get, which is, I'll read it off. 2 types of parasites, borreliosis, antibiotic resistant bacteria. These are people, this is a source of chronic inflammation, and I call it a petri dish for pathogen. It's warm, it's dark, it's moist, and there's a poor blood supply. So I created a protocol to treat these called the Curatola Cavitation Protocol. And if anybody wants this, I will make this available to this meeting. They can learn more about it. You can get Steve, I'll make this available online with you, for you to give as a gift,
Right.
along with, I also have another one called the top 10 sources of chronic inflammation and toxicity. People need to be educated. They need to know about these, stealth areas of chronic inflammation and toxicity. And another one, I'll read some off. Gum disease, jaw cavitations, amalgam mercury fillings, non-precious porcelain fused to metal, crowns of metal appliances, which often have chromium, nickel, and other heavy metals, titanium metal implants. Why is titanium metal implants a concern now? Which I had 3. They're a concern because now we see them as 100% of metal implants. By the way, along with 100% of endodontically treated teeth produce endotoxins, which are bacteria and bacterial byproducts. These are sources of chronic inflammation and toxicity. And this is why functional medicine doctors cannot get you well if you do not address these sources of inflammation and toxicity in the mouth. One other thing I want to say about jaw cavitations, and that is an invasive jaw surgery. I have had many patients come to me who had this cavitation surgery attempted by dentists who call themselves biologic and are inadequately trained. And they do not have the surgical competence and the surgical level of experience to just drill into a patient's jaw and try and clean this out. They can hurt the patient. And they do it. Patients are coming, asking for it. It's very big right now because, by the way, over 80% of people that have had their wisdom teeth out have some evidence of a necrotic area of bone that never healed. And that's because bone needs a scaffold to be able to regenerate and heal. You just don't, that's why every tooth that's extracted should be treated with a bone graft, with a bone mineral, and bone graft, because that's a scaffold that lasts long enough for your body to generate new bone, while the scaffold, which is the bone graft, is taken away by the resorption of the osteoclast cells that take away the old bone. So very important that the practitioner is experienced. Ask him where he trained. I know in the bio that you said, I extracted 973 teeth in the Peace Corps in the 6 months I did that at the end of dental school. That is, I've been doing oral surgery 40 years, and I see dentists who have less than 5 years experience attempting these because technically they're licensed, but they are not experienced or at a level of surgical competence. That's the only thing I want to say about jaw cavitations. There needs to be a lot more training and a lot more education to the dental professionals in this area.
Thank you very much. Dr. Curatola, how would someone follow up if they wanted more information, if they wanted to see you, if they wanted your book? What's the best way to get more involved with you?
They can go to at Dr. Gerald Curatola, Jerry with a G, at Dr. Jerry Curatola on Instagram, at Rejuvenation Health on Instagram, or just go to our website, Rejuvenation Health.
And do you see people online or only in person?
No, as a matter of fact, I highly recommend everyone get a CBCT taken, and I routinely read them because that's another issue, is you really need to have someone experienced in reading CBCT images, because there's a lot of information. And unfortunately, again, and I'm sorry to make a big deal of this, but there's too little training that's necessary for people to know, for dentists to really properly diagnose a jaw cavitation or any other inflammation or toxicity that's not seen on a regular dental x-ray. So if you get a CBCT, you can contact our office. We can set up a way for it to be sent to us by Dropbox or whatever, and we will do a virtual consult with you. I personally we'll do a virtual consult with you.
Okay, thank you very much. Dr. Jorgensen, how do we stay in touch with you? Are you available online? What's the best way to stay in touch with you?
Yeah, so all my information can be found in two places, livingwellwithdrmichelle.com. This is my website that is my product and information site. And if people want more information, I saw a lot of questions go through here that we couldn't get to. There just wasn't enough time. For sure, watch my individual presentation. I'll get into a lot of these questions that we didn't have a chance to address. But there's also all sorts of free information on my website. So go there if you have questions. And there's a lot of what I like to say is that I simplify complex things and make them very approachable. So go there and you can watch information on all the things we were talking about today. My dental website is totalcaredental.com, and you're also welcome to go there. We do have patients from all over the world that come, and we do also have virtual consultation options also. And we have specialists. So I have actually a surgical specialist in my office. We have TMJ specialists, pediatric specialists, orthodontic specialists, all under one roof, because we try to really make it possible to provide this kind of care in every way that needs to be done.
Okay, can we unmute the audience so they can thank the dentists?
Thank you so much.
Thank you.
Everybody.
Thank you.
My blood pressure is there.
Good to do.
110
Are there now?